So guys, for the wrist, forearm's going to be in neutral for your gravity minimized positions for both flexion and extension, right? The wrist is hanging off the table, and what you're going to do for all your gravity minimized positions is you're going to ask them to do regular flexion extension of the wrist. So for flexion we'll start with, forearms in neutral, resting on the plinth. At the distal forearm, palpate flexor carpi radialis and flexor carpi ulnaris. So we already know where to find those, right? Flexor carpi radialis is showing flexor wrist, right? Flex up. The tendon that's most radial, right? Almost, it's just off the palmaris longus. You're going to find flexor carpi radialis, the one that's most ulna, toward the pinky side, if she only deviates a little bit and flexes, is going to be the tendon of flexor carpi ulnaris. So you're going to palpate those two for trace measurements, right? So you ask the patient to flex the wrist. She goes through it. You do overpressure. When you push, make sure you're pushing from the metacarpals and not from the whole hand, not from just one side, so that you're going into any pronation or supination of the forearm. Okay, so push from the metacarpals and be even in your pressure so that it stays in the correct plane. Let's see, gravity minimized position, all the rest of it. For your, it's going to be the same thing for your gravity, 2+, you're going to give resistance like that. She's going to go ahead and flex your wrist, and you're going to test end feel, right? For extension, same thing on the dorsal part of the forearm, and test end feel. Does that make sense?
I'm sorry, just look where Dr. Norman's stabilizing. You can see how he's really holding above the wrist. He's holding proximal to the wrist. And that's an important thing. Don't hold up here, don't hold up here. Make sure you're holding as close to the wrist as possible without interfering with the movement.
So combining these is a little bit easier because it's the same position. So you ask for active motion for flexion, overpressure. You ask for active motion for extension, overpressure. For your resistance, you give the resistance to the metacarpals. Ask the patient to bend the hand toward the forearm, go ahead, and overpressure. Same thing for extension, overpressure. Okay? That makes sense for the gravity minimized grades. When you're going against gravity now for extension, you're going to put that way, and you're going to ask the patient to move toward the ceiling, and your resistance again, 3+ is distal, 2 fingers, test end feel, and you go into the harder grades, moderate and max, comparing to the other side. So all that's the same. For your trace grade for extension, what are you going to be palpating? It's going to be a neutral. And what tendons are you going to try and palpate? You could palpate the extensor digitorum tendons, but more likely you're going to try and find extensor carpi radialis, brevis, and longus, right? So if the fingers are flexed, you ask Joanne to push against you, and you're going to find where they articulate with the second and third metacarpal. You'll feel a nice tendon bulge out. If you're not sure, ask for extension of the fingers, and you'll see right on Joanne that you don't want to be on your finger extensors. You really want to be on the wrist extensors, okay? Or you can do extensor carpi ulnaris. All right? That makes sense? For against gravity flexion, it's just the forearm is supinated. Keep in mind the same thing that Chris said. If you notice your patient's uncomfortable, make them a little bit more appropriate for the height of the table. Support distally, ask for flexion, and you apply the appropriate resistance. Right? Does that make sense for those? They're almost exactly the same. It's just whether you're doing wrist flexion or extension and your palpations for trace. Radial deviation, you're going to do forearms pronated. It's going to rest on the plinth. You can do similar to what Chris did, where you had like that for a friction-free surface. Okay? Let's just flatten that out. Okay. All right. So same thing. You're going to have a little bit more radial deviation than you are. You're going to have a little bit more ulnar deviation than you are radial. You ask for the range of motion, and you test your end field, pushing from the metacarpals. Make sure that you're not pushing like that, coming into wrist extension. Okay? You want to make sure you push with a flat hand and get a nice end feel. You apply your resistance like that. Okay? 2+ finger resistance, and you want to stabilize proximally. I'm just doing that the other way so you can see where the resistance is. At the metacarpals, guys, okay? Because these are wrist movements, not finger. So don't give your resistance here. Alright? So at the distal metacarpal for ulnaris, for ulnar deviation at the distal metacarpal, test for your end feels. Am I confusing anybody by just grouping it together like that? Okay.
Guys, a lot of people in the practical, they'll literally go to the lateral aspect of the thumb. Make sure you're on proper finger like Joel is showing you right here. Joel is showing you. You want to be on that second finger. You don't want to be on the outside of the thumb. All right?
Is anybody confused where to palpate for trace, for flexor, extensor carpi radialis, or ulnaris for ulnar deviation. Everybody know where to palpate for that? Sure. Gravity minimized position for radial deviation. Ask the patient to bring the hand toward the thumb side. Just to show you guys on camera, I'm going to bring it like this a little bit. So bring your hands up, Joanne. If they're in a more of a flexion moment, you can feel that same flexor carpi radialis. If they're more going into extension, you can feel that extensor carpi radialis, brevis and longus, again, at that second and third metacarpal, right? So at the base of the metacarpal, or here on the volar part of the forearm, flexion of the wrist a little bit, and you can see for radialis, for the thumb side. You can palpate either one, because it's ulnar and radial deviation. You could be on the flexor side or the extensor side. Just know you're palpating radial deviation, radial deviators or ulnar deviators. For ulna, you ask the patient to bring toward the ulnar side of the hand, so resist it. You can see her ulnaris pop out a little bit there. So extensor carpi ulnaris you can palpate, or you already know flexor carpi ulnaris from before, right? Ask for flexion and ulnar deviation, and palpate. So you want to try and do it in a gravity minimized position, but if you're really having trouble feeling it, for practice, learn where they are, and then apply that to the gravity minimized position so you can do it appropriately on the practical. I'm just showing you because it's easier for you guys to see. You're not going to be able to see flexor carpi ulnaris with her hand like that, right? But do it in the correct position on the practical gravity minimized. For radial deviation, you can just hang the forearm off the table, right? Let the hand fall off the table, stabilize the forearm.
Sorry.
Overhead's a little hard to find. So for radial deviation, you can just have the patient go towards the ceiling. Your resistance is going to be in the same spot at the distal metacarpal. Again, your end field is at the distal metacarpal, keeping the correct plane. Don't do this or this on the practical, okay? For ulnar deviation, how do you think you guys are going to do it against gravity? Any ideas? What position you can put them in? Laying down which way? Prone. You can put them prone, or you can have them supine. I'll show you supine for now. You can lie on your back, Joanne. I guess you have over here so we can show up and catch the same spot. So for ulnar deviation against gravity, right, you want the ulnar aspect of the hand and forearm to face the ceiling, okay? So stabilize the distal wrist. You act through the same motion. Active first, overpressure, 2+. Bring your hand toward the ceiling, 2+. Test the end field. And moderate and max resistance. Again, keeping in mind these are small joints. You're not going to kill them like you were for the lower extremity, all right? You can also just do prone if you're not comfortable with that. If you have another way of doing it and it doesn't look awkward, just ask us and we'll let you know whether or not it's appropriate. Okay, just make sure you're against gravity to these. These ones are straightforward. They're not like some of the scapular motions where the positions change. Everything should be gravity minimized as it makes sense anatomically, and everything should be against gravity as it makes sense. So nothing tricky about these like the scapula. Okay, they're all straightforward. It should be against gravity, gravity minimized, normal positions, normal grades. All right? Any questions on that stuff for the wrist? All right. Go back in the chair. For finger MMT, guys, MMT for all of your finger motions are going to be in this neutral position. Okay? So all your all your resistance, all your MMT is going to be in this neutral position here, okay? Except for AB and AD, the fingers are going to be pronated, right? So she can do that motion. And for the thumb motions, again, they're going to be supinated for all the thumb motions, all right? All the rest of them are going to be done in neutral for all the fingers. You guys have the grading scale in your book of what normal is for finger MMT? Yeah? Right, so 5 is full range of motion, max resistance. 4 is moderate to min resistance. 3 is just full range of motion. 2 is partial range of motion. And 1 is palpable, observable contraction. So there's no 1+, 2+ grades. You don't have to do 3+ for the fingers. There's not going to be gravity minimized positions or against gravity positions for the finger. It's all going to be neutral for the fingers. It's going to be pronated for AB and AD, and it's going to be supinated for the thumb. And no, don't worry about whether or not you're against gravity. Just make sure you're going in the right plane of the motion, okay? And follow the slightly different grading scale as compared to what we normally do. All right. So for MCT extension, you're going to be palpating extensor digitorum, extensor indices, and extensor digiti minimi. Right. Hands resting on the plinth, forearms in neutral. And you can ask the patient to, you can stabilize the wrist and MCP joint, and you're going to ask for what? You're doing extension of the MCP, you're just going to ask for extension of the fingers, right? You don't really have to support, you just want to make sure you go through active range first, test overpressure, and then you're going to give your minimal resistance, moderate resistance, max resistance to determine whether it's 4 or 5. Okay, so min mod for 4, max for 5, 3 is just full range of motion. Does that make sense? Don't worry about changing positions, all done there. All the fingers are the same, stabilize the distal metacarpal so that the MCP joint is working and you're isolating it. Okay? Does he specify there? Yeah, he wants you to keep the PIP joints flexed if you can, so that you isolate the more proximal finger extensors as opposed to extension digitorum longus, you're going extension digitorum brevis, right? Does that make sense, everybody? And for profundus, the same thing. On the other hand, you're going to ask for flexion of the PIP. For profundus, you're going to ask for flexion of the DIP. For superficialis, flexion of the IP. So he asks you to isolate a little bit, only on certain ones. So just keep in mind, we're only going to test you as your text shows. For IP extension, you're trying to hold the MCP joints in flexion and asking for extension only of the IP joint. So you're going to try and block that flexion. Relax. Try and just move this joint here. So you're going to come from flex position all the way into extension. Let's relax that thumb. And you're going to test end feel. Okay? Your resistance should be applied to the appropriate spot, right? The distal part of that moving joint. So don't go to the tip of the DIP, go to the tip of that middle phalanx. Okay? Min mod and then max resistance and testing end feel. Other fingers is exactly the same, guys. You just move the other fingers out of the way and test that finger. Okay? Stabilizing proximal, moving only the joint that you want motion from. So stabilize the proximal phalanx as she moves the middle phalanx. Does that make sense? Okay. MCP abduction. Your interossei muscles and abductor digiti minimi. The hand's going to be pronated like that. You don't have to worry about friction-free surface necessarily, because you could if you wanted to, but it's not a gravity minimized grade. They're all done in this position. If you see them sticking, put a towel. It doesn't indicate to do it here in the book. Just make sure they have free motion. So you're going to palpate your dorsal interossei muscles, moving the fingers away from the middle finger, and the middle finger can move in both directions. So you're doing MCP abduction here. So you're stabilizing the metacarpals. You're giving your resistance when necessary to the proximal phalanx, right? Does that make sense? So again, don't give resistance here, although it seems simple. That's not correct. You have to give to the proximal phalanx, stabilize distal metacarpal, all right? And applying your min and mod grades, testing end feel appropriately. You don't have to lift the fingers out of the way. You can move it out of the way if you're testing like the 4th digit, and wherever you get to, you get to. You don't have to start lifting fingers, flexing fingers, extending fingers. Move it as much as you can out of the way, and then move it to that finger. If it gets to that finger, and that's where it ends, that's where it ends. That's your end feel, okay? You don't have to lift it out of plane, because then it's not correct. It's not a pure motion then. Adduction, same thing as your palmar interossei, keeping the hand pronated like that, and you ask for the motion to come toward the middle finger, and your resistance is applied appropriately. You're going to get in the way of yourself a little bit here, but there's really no choice. So you go as far as you can toward the middle finger, and push